I'm delighted to be here and I hope you enjoy it. Don't hesitate to ask any questions and/or we can get this going. And I'm sorry we're a little bit late. Things happen, correct? Well, I talk about all of the options for seniors, and some of them require some discussion, some you already know. But the important fact of this presentation is, as you start thinking of options for your health care as we age, and I'm talking about as we age, the research says at 55, that's when some people start looking for options for living experiences. Oftentimes, if you are married or have children, that's about the age that they say empty nesters. So they start thinking, do we really need this big house? What should we do? So it starts at that point. So think of, some people don't start at that point till 75, but the average, they say, is like 55 when people start thinking about them. So the first thing they think about, one, is apartment rental. Would that be the best thing for them? We have this big house, we don't need it anymore. But again, all rental costs are subject to the owner. So if you want to go into an apartment rental, you really have to evaluate, is this right for me now? Will this be right for me later on? But some people do choose that option. Any senior apartment without options, and there are some we'll talk about, there is no health care provided. And as we age, that's something that's back there, especially if you're going to start spending some money for rentals. There is the wonderful 55 and older apartments, and they are the newest rage. They started, I would say, about maybe 8 years ago. And they started basically in modified apartment buildings, and they sold. They loved them. People wanted to get into areas with their own age group, and they just loved them. But they weren't like really great looking. They didn't care. But now the newest rage is, they are lovely. They are beautiful. They're mostly one-story cottages so that you don't have to worry about steps or elevators. There is select pricing in all of them because there's so many, and it is the rage now that they really can sort of do what they want to do, add on to what they want to add on to, because lots of older adults want something like that. A big reason, they are with their peers. They're with other people that are about that age, 55, and we say 55 and older, 55, 65 age group. They have people, they see people, there are things to do. So it is select pricing, and that's one thing that you have to look at. Distinctive home or apartment may include fee for amenities offered, could be a house, a clubhouse, a pool, and programming. They do a little bit of everything, and the pools are generally well done. Everything is well done because the owner of these 55 and older apartments, they want you and they are full. They are full all the time. It's ideal, it's wonderful, no medical care. But some are really getting, well, over the years, they have advanced to what people want. Sometimes they actually rent an office for a physician, so that if you want to change your physician and go to Dr. Brown, who you haven't met before, but he seems nice, he is certainly well qualified, and that becomes your primary care physician. There is no connection or affiliation with the apartment building or cottages, but that person's there. And I think it gives people in these settings a comfort level, because you know that he's on site. He's probably on site maybe once a week, but it's just enough to make you feel secure. Then we have the adult day programs. They started, I would say, in the early 90s. First adult day center was in Pennsylvania, and it was located in Allentown. As a matter of fact, I have to brag a little bit since I couldn't get all the program here today. I'm bragging about something. I was the founder of the Adult Day Center in Allentown. We recognized a need in the area of family members that really were concerned about their mom or dad, even aunt or uncle, because they had to go to work and they really couldn't stay away from the house 8 hours because their family member, mother or dad, really was just sitting in front of the television all day. What else could they do? They were not really comfortable going outside for a walk or doing anything outside of the household because they just weren't well enough mentally, cognitively. So we decided to start this adult day program in Allentown, and it was wonderful. I will actually tell you mini story because we started late, but when the first clients came into our adult day center, I actually started to cry, not for any reason, but I realized the need for these family members to trust us, although they trusted Westminster Village and Allentown and the people that they connected with. They trusted us with their family member for, could be 6 hours a day, could be 8 hours a day. It could be a little bit of everything. Some people came once a week. And as we grew, the program grew. A day program is for adults who need support throughout the day. Their family member either works or no longer able to manage the family member's activities of daily living. Most centers provide transportation, bathing if requested, breakfast and lunch. Time could be adjusted according to client needs, activities adjusted to meet the needs of the clients. So the program is, could be from 7 a.m. to 5 p.m. They had breakfast and lunch and snacks in between. But the important part, they started to socialize with other people. And we had one gentleman who absolutely, positively did not want to go to this day program. Did not want to go. So we advised the daughter, why don't you just take him, perhaps you stay for breakfast or just coffee with him and then leave. Almost like, I'm not comparing the two, but it's almost like if you had a child in nursery school and they tell you, just leave, they will be fine. Well, it was the same thing. The gentleman absolutely met another gentleman. They started to talk. The next day he came in, he looked for that same gentleman and they started to socialize. It was almost a miracle. So it met such a need for clients in our area, the Allentown area, that it just grew. As a matter of fact, it has grown and it is still there. And they needed evening hours because some people were working from 3 to 11 or they were working a later shift. So we provided that option if they wanted it. Most people didn't, but whatever happened, they enjoyed it and we accommodated. But they grew, they were not alone, and it was just a wonderful thing. And I'm bragging about it because it met such a wonderful need. Now we have personal care or assisted living communities. Personal care and assisted living, they're the same. But in the state of Pennsylvania, there were some problems in certain areas. They did not want to just call it personal, or they did not want to call it assisted living. So that's why sometimes you see personal care or assisted living. It depends on the county that the site is. Has nothing to do with the care level. They are both the same. Personal care or assisted living are the same. There are people who needed assistance in activities of daily living. Apartment or a cottage, either one they could have. There's always a fee for service. It can be standalone or can be part of a larger community. When I say that, there are personal care homes that's all they do. They're not connected to anything, but the activities of daily living are there for that person. Also in personal care or assisted living homes, the rates are really based on how much care that person is. Oftentimes they could have as many 7 care levels. And I would always break it down. The easiest is 4 care levels. One didn't really need anything, but maybe queuing for breakfast, something to just alert them. It is breakfast time, let's get dressed, those kinds of things. Or it can be as much as offering the bathing, activities of daily living, bathing, dressing, working together so that they aren't just sitting, trying to motivate them. And it was, again, it's another option for seniors. and it would be for seniors that needed just a little bit of care, not nursing care, just some supportive care. They range in size from as few as 25 to over 120 applicants. Typically, the few levels of care are offered. They may have up to 3 meals daily. Some personal care homes that are standalone, they will offer breakfast, lunch, and dinner depending on the needs. So this is almost you pick and choose what you need. Assistance with personal care, help with medications, housekeeping, laundry, and supervision. So one of the things that very, very important, folks that are starting to get some cognitive or need some cognitive assistance because of memory issues, medications were so important in personal care homes. That was one of their biggest things that they did for their residents, to provide that safe medication administration. Memory support. This definitely is a fee for service. Again, it can be part of a larger continuum. Significant memory issues, Alzheimer's or dementia, requires 24-hour supervision. If you have this cognitive loss, staff offer activities to engage persons, are monitored for changes in cognitive level and safety concerns. So this memory support is absolutely what is needed for those persons who are have either Alzheimer's or dementia, and we know dementia is just a symptom. What it means is forgetfulness. And so the memory support can be standalone or can be part of a continuum. Skilled nursing facilities can be standalone or part of the continuum. I'll say that for this one also. They offer a wide range of healthcare services focusing on medical care. These services include nursing care, 24-hour coverage, supervision, 3 meals a day. It's assistance with everyday activities. So the person that is in a skilled facility really has cognitive loss, maybe, or they're just not able to care for themselves and they need assistance every day. Rehabilitation services are available, such as physical therapy, occupational, and speech therapy. Some people stay for short-term care post-hospitalization. And this is something very important because after you've had, let's say you go in for hip replacement and you have the surgery, everything's going well, but you really are not ready to go home. And it's not safe to go home, even if you have a caregiver. So most people want to go to a nursing center that offers the physical therapy, occupational therapy, that I already mentioned in the slide before. So some people say for just short-term care, after recovery, they are discharged home. So again, it's another option for people that need help. And that's why we talked about healthcare options. This is short-term care, but it is provided in a nursing or skilled nursing center. The rehab is so important. Most nursing center residents live there permanently due to ongoing physical and cognitive issues requiring 24-hour nursing care and supervision. So we have that short-term stay that is also so needed because you've had your surgery, you're feeling good, except you still need some support as you're doing your therapy. So that is a really big part of the skilled nursing center in our communities. Now we get to the continuing care retirement community. This is I leave that really for last because you've already heard about all of the other things that happen along the way as your options of care. But the continuing care retirement community is just so popular because you have different levels of care. In other words, you go to a nursing center, you really are skilled services, you need nursing care. But in a continuing care retirement community, you don't. You can have it if you need it, and that's what that's all about. And that's why it is so popular. In a CCRC, which is the shortened terminology, you purchase a unit, contractual commitment. So you purchase it or you have a contract with the community that you're going to. They offer multiple levels of care. They provide different levels of service in one location. Fees are all determined by care needed. So you join the CCRC, Continuing Care Retirement Community, with no healthcare services required. So you are independent. That's what you're all about. You are independent. The next level is personal care services. We already talked about that. Memory support, we've discussed. Skilled nursing. Now, some service can be accomplished by private assistance. So if you move into a continuing care retirement community and you moved in independently, as you progress in needing care, you can pay for private assistance in some communities. Some will say they discourage it because when that happens, if you have private care in your apartment, you really lose sight of the retirement community that you moved into. The caregiver sort of keeps you, active and safe, but you're not integrated into that private community. So it's not as, in my opinion, it is not as, it doesn't meet all the needs that I would if I had a family member that joined a continuing care retirement community. I would really like them to stay in that option, that they see other people, and it just keeps their socialization just a little bit better. So that is about that. Senior housing, what does it cost? Now, I will tell you that I have searched, and everything that is on this slide, I will tell you I averaged. So at least I thought it was important if you, let's say, wanted to go to an assisted living community, about what would you have to spend? And again, this is just a comparison of multiple communities. So the 4 primary senior living communities that I searched are the independent living. It's either a rental or a purchase of a house, townhouse, or apartment. The cost of independent living is based on size of the community. The location really counts. The price range may be $1,500 and up to $10,000 monthly fee. Now that $10,000 monthly fee, they're like wonderful places. They're huge apartments. They have probably their nursing levels are higher than needed. So, but it's available, and that's what people look towards. Assisted living or personal care, 1 bedroom, single occupancy. I can't see it, but I know it averages approximately $3,800 a month for personal care services. And as I said, in personal care services, you go from 1 level to level 4. So that increase certainly does increase the rate of payment for personal care services. But again, your family or whoever is responsible for you absolutely is aware of the changes and why you need extra support. But that is wonderful for assisted living and personal care services because you have those options. The last is healthcare nursing centers, 200 to 500 daily rate. That is, again, averaged, and it depends on so many factors. But also, when you are in healthcare nursing centers, you are eligible for Medicare and Medicaid services, which makes that extremely supportive, so that you're not paying the private pay fee for that daily rate. So it does help with Medicare. Those people that I mentioned, if they had a broken hip and they had to go to a skilled nursing, and that skilled nursing is in the CCRC, it's right there, they can have Medicare first, and then you start paying privately. So all of these are really important things to be aware of, that cost, but all rates are subject to area and community choice and reference sites. Believe me, when searching for the correct community for you, take time for the best community. And I always say, sometimes, as I said, that 55, you start thinking about it. It's just really nice to shop around. I know I really do get, well, my age isn't a factor, but I get so many different flyers mailed to my house. I probably clicked on something ages ago, and it's really interesting. You find out about all of these different communities available. And so often, if you click on something and you look interested, they'll have you for lunch. They want you to come for lunch, take a tour of their facility. And I would say, take a friend to talk so that you can share information and say, I don't remember exactly what that room really liked, even though you have a flyer about it. So it's a great time, take a friend to explore. And you'll really learn so much about the things that you really have to be informed about when you're searching for a community. Then I also included 2 documents to support your care. In doing healthcare options, I felt I would be remiss if I didn't talk about these 2 forms. And as I'm speaking, if you already have healthcare directives so that your family member knows exactly what you want, kudos to you. And if I'm going to clap for you, because you really want some information so that, if you fall, you're going to the grocery store, you get out of your car, you trip and fall, and then all of a sudden there's an ambulance there, they're taking you to a hospital. You know that you have information that your family member can, go to the hospital wherever you're going to be admitted and say, this is what my mom or dad really wanted. So that's why I'm sharing it with you today. So the Living Will provides treatment instructions in the event of end-stage medical condition or permanent unconsciousness. And I'll share with you the POLST form. This is a Pennsylvania order for life-sustaining treatment. It's signed and it's dated. And these 2 forms are interesting. You can look them up on your computer. And for those of you who just want some extra information or see what you really need to do to make sure that everything is covered in your services. The Living Will. The Living Will provides healthcare treatment instructions in the event of end-stage medical condition or permanent unconsciousness. That is what a Living Will does. It provides treatment instructions. You are the one that are giving these instructions to the caregiver, to the emergency room, to different places. This is what I want if I should be under end-stage medical condition or permanent unconsciousness. If you're permanently unconscious, you're not going to tell that physician in the emergency room, this is what I want. But this Living Will instructs the parties involved what you want. The healthcare treatment instructions exercise your rights to make your own healthcare decisions. It is documented, it is written. These instructions are intended to provide clear and concise and convincing evidence of your wishes to be followed when you lack the capacity to understand and communicate and will communicate your treatment decisions. If you have an end-stage medical condition, which may result in death, despite the continuation of medical treatment, or you are permanently unconscious, such as irreversible contact and irreversible vegetative state and no hope of significant recovery, all of the following apply. Examples: all life support or prolonging procedures will be withheld. No tube feedings, no CPR, no dialysis, antibiotics, no surgery or chemotherapy. So this Living Will instruct the people taking care of you at the hospital what you want done. It's a very important document, because I have been at the bedside when a family member really is not able to communicate, when a family member can't speak for themselves. These documents are so important, because you know what they want. It's already written down what they want. And you aren't the one to say no CPR. The Living Will must be signed. Signature and date is required. Witness of the Living Will must sign and date. In the Living Will, the notarization is optional. But again, I think it's important. If you've gone through this trouble to write your choices down, I would have it notarized, but in a living will, it's not, it is optional. Living will should be reviewed as needed or changed if required. In other words, you've written this living will, and maybe you did it thinking, well, I don't think I need XYZ put down in this living will. But you start to age and you start to wonder, should I review it? The answer is always yes. Review that living will so that you know exactly what you said 5 years ago are still what you want. So I think it's so important. It's almost like getting your house in order. It's the same thing. You want to get your life in order. And I'm certainly not leaving you all with this, wow, I feel a little bit down today. I'm not. I'm just saying, get everything in order that you can do to make your life and your family members' lives easier. The POLST form. This form is the Pennsylvania Orders for Life-Sustaining Treatment, and it's called POLST. This form is followed for life-sustaining mechanisms based on patient preferences and medical indications or decisions. This POLST form must be signed by physician or nurse practitioner and by the patient or their surrogate. In other words, a POLST form is telling people if there is an emergency, if I collapse at home, the EMT come in. Somebody's called 911. The EMT comes in and we see a person that's unconscious. They have a pulse. They are not able to speak, but they have a POLST form. And this POLST form can dictate what is being done. The POLST form is an order sheet based on the person's medical condition and wishes at the time the original POLST form is completed. The list of options are CPR, cardiopulmonary resuscitation, medical interventions, the use of antibiotics, intravenous therapy added on site. These are very, very important things that an EMT person goes into your house. You're not speaking. What do you do? Well, a person that writes a POLST form or completes a POLST form has medical conditions. They're not out and about. They're not playing golf on weekends. They have some critical medical conditions, but they are still at home and they are still able to be at home. And then something happens to them. So they and their physician both decided, let's get a POLST form ready for you. A lot of people will put a POLST form in an envelope right in their living room or wherever they want to place it, and they know somebody would be able to read it and designate POLST form. EMTs know to look for it. Let's put it that way. Some people will do the same thing, put it on their refrigerator, magnetize, put it in an envelope. It just makes everyone's lives much easier, and I would say important. This form is valid at time of signing and must be reviewed as change in condition warrants. It's key. You discuss it with your physician. This is a form that has to be completed by your physician. So again, you're not going to complete it when you don't need it. But if you have some concerns, you can talk to the doctor next time you visit or your nurse practitioner and get their feelings on a POLST form. Because this form, it's a medical order. That's what it is, just like a regular doctor's order that is signed by them, signed by the patient, and also signed by the surrogate. So that if something does happen, that signature is also there. So it's really important to understand this form. I only used the two because I did not want to, I just wanted those two because I thought both of them were important. But if you don't have anything like the living will or anything that documents what you want, if you should become ill, I would say, start thinking about it, talk to your physician about it, talk to your family about it. I know I always talk about when family members come home at Thanksgiving and they don't live nearby anymore. This is like such a typical time that you look at your mom or your dad, they say, wow, we haven't seen dad in like 6 months. Well, especially with the pandemic, that has happened. So you say, well, things are changing, and you really have to you have to really plan for the future. When you plan for the future, things go so much easier for everyone. Now, before I open for questions, when you start visiting, or if you should visit a continuing care retirement community or any level of care, because you're starting to think about it. Should I do this? Should I do that? What decisions do you really want to make? I just have a few things that I'm going to read because I think they're so easy and important. So you decided that you're going to take your best friend, Mary, and you two of you are going to go to, I'm going to use Cathedral Village, and I'm just using that. This is not Cathedral Village statement, but it is from Presbyterian Senior Living, which I work for them. But anyway, it's so important. You're going to Cathedral Village. You've noticed that they have a luncheon for people just to come to meet and give a tour. These are some of the things, wherever you go, you should think about. First of all, what is your overall impression when you visit? Do you feel comfortable with the location and overall presentation of the campus? So let's say you live in Allentown. No, let's say you live in Plymouth Meeting. Is it close enough for you to get here? Is it something that your family is close enough to visit? That's important. Do they offer cottage or apartments that appeal to you? When you started to look around, does the whole building appeal to you? What is the travel time for restaurants, theaters, airports? In other words, when you're moving and you're looking for a place to live, you're really doing it for yourself. So is it close to restaurants or museums, and you'd like to still do those things? And hopefully the community will also be providing transportation, something else you could ask. Are they a continuing care retirement community, which I talked about, or a rental community? What are the benefits of either for you? Is the community accredited? And that's an easy way. Oftentimes when you first walk into a community during the reception area or whatever, they will have their results of their latest surveys, and that's important to find out. What levels of service does this community have? Do they have all of the levels that we talked about? Independent living, personal care, skilled nursing center, and skilled health centers. Are there services conveniently available to help you to age in place? That's what these CCRCs are all about. Are there services in place if you need short stay? Rehab, I talked about that already. People go to a nursing center if, in fact, they've had a fall, they've broken a hip, and now they need some rehab. Are transportation services offered? And is there a fee? Well, you might want to go to the Museum of Natural History in Philadelphia, and Cathedral Village is in Philadelphia. Do I have transportation to get there? Was the process for discussing your care needs if your health begins to decline? What is their process? Do they have meetings? Are there visitations in your apartment? Can you see the executive director if you need to see them? Do they have recent customer satisfaction survey results? Every community that is worth their presence in real money would say they should have their ratings, skilled nursing, healthcare reports, so that you know, well, last year the health department came in and had a glowing report, or there are a few things that they corrected. Can you customize your apartment or cottage? A lot of people love to come in, they look at the apartment, they think it really looks fine, they enjoy it, they think they'll be happy there. Oh, but they really didn't like the color, it was so bland. Can you have them paint your apartment before move-in? The community life, what is the minimum age that I can move in? I already talked about that 55 and older specialty. That would be a standalone apartment. But what is this at this place? Are the staff and residents friendly? You know, as you walk around, certainly during the luncheon, you're going to be walking around, you're going to be on tour. Are people smiling? Let's see. Do they offer complimentary overnight stays to provide you an opportunity to experience life on their campus? I think this is a wonderful question because it's so important. You know, you go through the tour and then you come home and you think of all these things you wanted to ask. Well, some places do have that opportunity to just stay overnight, and you know, the next morning you get up and you have breakfast with a assigned person. And wow, that was really, I just didn't have to do the tour. I could actually stay overnight and see what the campus is all about. Does the campus host events that will provide you an opportunity to spend time with the people who live on their campus? And again, what do the current residents have to say? Because you will be or should be introduced to residents. Are they pet friendly? Well, if you have a little pooch that you've had for 5 years and they say no pets, that might not be the right building for you. Are they tobacco free? What are the finances? What do I really need to be able to pay for this lovely place? If it's a standalone campus, are they part of a larger network? And I only say that because you have two ways of looking at this. If they're part of a larger network, then there seems to be, they sort of keep in touch with the best processes, because they have not only this community to look after, they're looking after all of the communities under one umbrella. What happens if you outlive your resources? Very, very significant. Some places will just accept your Social Security or whatever you deem appropriate, and some will not. What does the monthly fee cover? You know, you do pay a monthly fee. Well, if I have to have medication help, do they support that, or is there a fee for service? What are their policies related to transitioning into another unit of care? I think that's so significant. Oftentimes, when you need some support and you get that support, moving to a different level of care, and you're better, can you move back? That's the good question. And most often, you do want that person to move back to their level of care. The most important question, can you envision yourself living there? So if you can, that might be one of the things that you check off and say, I really like that place, or I would not ever even bring my worst enemy there. And I am just joking to say, that's why it's so important. Once you start thinking about care needs, or just what's going to happen as you age, it doesn't hurt a thing to go out there. And it sometimes takes, and I say this from my past experiences, that sometimes it takes an individual maybe 4 years to move in. They have to decide, they have to talk to family. Again, they're still well, they have had no real issues, but they're thinking about it. So it's not unlike a person that starts the process, going to a luncheon to see what the facility is like, to take up to 4 years. When you've taken that length of time, you've really researched everything, this is the time that you need to do it. You need to do it when you're well, when you can enjoy all of.
Okay, Jerry's internet froze, so hopefully she'll realize that. I'm gonna give her a call.